Good morning, everybody. I don't have a slide, PowerPoint. And for people who know me, know that I can go on and on and on when talking about this issue. So I will read something I wrote as my way to make sure I'll stay on track. So let me start by saying that it's an honor and a privilege to be one of the speakers here today. I have to admit that my experiences with academia and mainstream systems in general have made me very skeptical about the role these systems play when addressing issues affecting our communities. So I was not expecting to see myself participating of an event like this. And many of you who know me are as surprised as me, probably. So, however, I have been observing the authentic and beautiful work that Kathleen and Rhonda have been doing with the Health Equity Working Group. And I truly feel that work is very authentic and beautiful and powerful. So I had to say yes when Rhonda asked me to be here as one of the speakers. So let me add that in addition to my skepticism, public speaking is not something that I particularly enjoy. So, so trust me, it was not easy to think of what to say, what's the message, what's the frame. So for all these things I'm just saying, and because of the nature of my work as a community organizer, and because of my world view and values, I want to ask you to listen to me as Monica, and I want you to forget about, well, it's not there, great, that MD is after my name. I'm trying to speak as a community member from one of the communities of color experiencing disparities or health disparities here in Minnesota. So when I saw my name, Dr. Hurtado, being a speaker here, it was kind of, oh no, wrong. So please keep that in mind with my remarks. And I want to add that I want to challenge the notion that knowledge, in order to be valued in spaces like this, needs to be created by experts in the academia who have credentials, titles, and many letters after their names. We need to value all kind of knowledge and expertise. And after the amazing remarks of Dr. G and Dr. Van Raan, I hope you will allow me to speak as a Monica, a community member who has spent some time trying to understand and to address with many others those issues related to well-being and racial justice. So as a community organizer, one of the basic tools we use in our work is our personal stories. We are diligent in identifying our self-interest that is defined as me among others. And we put our skin in the game because we firmly believe our liberation is bound to one another. So following that basic principle of community organizing, I will share my story with you. And hopefully by doing so, I will be able to convey a message that will add some perspective and nuances to the conversation of what can be done to end discrimination in the healthcare and everywhere. We need to see ourselves as part of the struggle, and regardless of our job titles, each of us need to identify what is our part to create healthier communities for all. So, going back to my story, I was born and raised in Colombia. a country which has been in a civil war for almost 60 years. And as a result, we have one of the largest internally displaced population in the world. This means that through more than 5 decades, millions of families of farmers, campesinos, have been forced to leave their land, leaving everything behind, and moving to places without the resources to address the issues and challenges these families have to deal with every single day of their lives. My grandparents were displaced farmers, and both of my parents grew up in extremely poor conditions. They got married, and our family continued being part of that cycle of poverty. I'm the oldest of 5, and one of my brothers was born with a congenital heart problem. As you will imagine, it was already tough to be poor, but to have a loved one with a chronic condition made our family situation much more complex. Then, I spent a lot of time helping my mom when visiting doctors, and the healthcare system became part of our reality as a family, almost our second home. My brother died when he was 5 and I was 9 years old. And those interactions with the healthcare system have had a lasting impact on me, to the point that when I was 17 years old, I made the decision to become a physician. I was very lucky of have been accepted as a student of the Faculty of Medicine at the University of Antioquia, a public college in my city, Medellin, which will be the equivalent of the U of M here in Minnesota. Out of 4,000 applicants, they selected 90 people, and I was one of them. I was young, and I wanted to save the world. And I wanted to be part of the people doing good things for families like mine. I graduated and started to work, but pretty soon I realized that the knowledge I got at the School of Medicine had not prepared me to deal with the realities and complexities of the job of a healthcare provider. For instance, what medicine or test can a provider prescribe to a 70-year-old retired guy who is raising his 7-year-old granddaughter because his daughter has chemical dependency issues and is living on the streets? What words to say to that same guy who's asking you, crying, if it will not be better for his granddaughter to be adopted by a family who can take a better care of her? How in 15 minutes? And when you have other patients waiting for you and a tons of papers to fill out, this story I just shared was real. Happened to me in Colombia. Stories like that one made me reconsider many things in life, like that one of continuing being Dr. Hurtado. Well, a couple of years after that story and many more, I ended coming to Minnesota. That was 14 years ago. I came to stay 1 year. Minnesota is nice. Well, here I cannot practice as a physician. Speaking about the structural barriers and structural racism, the process to validate credentials and in a time of shortage of providers. So I cannot practice as a physician, but had the privilege to work as a medical assistant and health educator for a Latino youth development program called Aquí para ti, Here for You. This program is housed in a community clinic in South Minneapolis, and initially was funded by Eliminating Health Disparities Initiative, which is part of MDH, Minnesota Department of Health. Excuse me. I was part of that program for 12 years, and during that time, I had the privilege to have one-to-one interactions with almost 1,000 Latino youth and many of their families. I had the opportunity to witness the resilience, strength, and wisdom of one of the communities dealing with a lot of challenges in their lives and experiencing multiple barriers. I saw their fear to be seen at the clinic and then to get a bill they were not going to have the money to pay. I saw how difficult it was for many of them to get out of school or out of their jobs to come to the clinic for a follow-up. I saw their sadness and anxiety as a result of the high levels of stress they were dealing with because of their immigration status or the housing conditions or by being exploited at work. I specifically remember a 14-year-old girl who went to the clinic after starting having bad grades at school. She was not sleeping at all and was feeling depressed. After a couple of visits to the clinic, we were able to realize how all these symptoms were connected to her poor housing conditions. This girl, her two younger siblings, and her parents were living in one-bedroom apartment, infested by bed bugs. This situation had been happening for months, and their landlord had done nothing to fix the problem. She was sleep deprived, feeling overwhelmed, with no sense of having any control over her life conditions at that time. One story of many. So it has been quite shocking for me to see the similarities between the challenges of people here in US with the ones I saw in Colombia. But United States, one of the richest countries in the world? How to explain that? The frustration and rage by seeing those situations grew, and I started to look for something else to do. I was immersed in the jargon of health disparities, which later became health equity. The conversation in the field was, go upstream. Everybody was talking about how critical it was to address the root causes and how to stop getting babies into the river. Sounds familiar? I knocked many doors, tried many things, until someone told me, you should check an organization doing training with members of communities of color. That organization is trying to achieve racial justice. It was 2011 when I finished my training as a community organizer with OAP, now Voices for Racial Justice. At that training, I got language, concepts, understanding, tools, relationships to be part of a movement which is building power. Power to change the conditions, the norms, the policies, the practices, the narratives that are responsible for the unequitable distribution of opportunities to be healthy, to succeed in life. A traditional definition of power in community organizing is the ability to act. I have another that is my favorite, says, power is the ability to define your reality. And we are building power to define and redefine the realities of communities of color who have been discriminated against for centuries. We are redefining our realities by identifying and addressing those structural barriers that explain why more white women are diagnosed with breast cancer, but more Black women are dying of breast cancer. We are building this power to reshape the tables, making decisions impacting our lives. I was part of the Governor's Dayton Healthcare Financing Task Force. What experience? I'm still recording. So I was part of the Governor's Dayton Healthcare Financing Task Force, which created recommendations to improve access and quality of healthcare. That work was finalized last January. And out of the 29 members of the task force, only 3 of us were people of color. However, we had great allies, and we were able to pass a recommendation that nobody expected was going to be part of the list of recommendations. We were able to recommend the governor to create a program to offer healthcare coverage to people regardless of their immigration situation. We are very proud to say that in Minnesota we have 95% of the people with 96% of the people with access to healthcare coverage. And we know that the healthcare reform has been responsible for that, for those good news. So the question when I was at the task force is, who are the 4% or 5% of those uninsured people? And it was quite shocking to see how hard it was for us, the task force members, to get the data that we needed to get meaningful, to create meaningful recommendations. So, but it was shocking to see one of the people in the task force saying that almost all uninsured people were people in transition between situations in life, and dismissing totally the situation of immigrant communities, undocumented members of the community who have no access to healthcare coverage, not the federal healthcare coverage at least. So how that happened, how that recommendation ended being part of the list? It was by using community organizing tools. It was by inviting people impacted by the situation to come and to share their stories, their struggles, that made the whole difference, and the recommendation passed. I'm good. Oh my God. So I want to share in these last 5 minutes another example of the work we have been doing at Voices for Racial Justice. Since 2009, I've been part of community efforts around data. We have asking the healthcare system to collect data using categories about race, ethnicity, language, and other sociodemographic factors that can help us to better identify priorities and better allocate resources to address health disparities. After years of conversations with Minnesota Department of Health, Department of Human Services, and other stakeholders, we were only creating reports to the legislature that were not changing the situation around data. It was 2 years ago when we finally started doing something different, and for me, groundbreaking, work around data when Minnesota Department of Health staff working with SQUARMS, the statewide quality reporting and measurement system, they got resources to do what we call authentic community engagement. And since then, we have been working in a partnership between Voices and Minnesota, in that office of Minnesota Department of Health, and we have been able to recruit people of color, leaders of communities of color, and American Indians to have conversations with members within their own communities to identify issues around collection, use, share of data. So through that effort, that partnership between Minnesota Department of Health and Voices and the leaders in the communities, we have been able to recommend best practices for collection of race, ethnicity, language, and other sociodemographic data. And now we are having more conversations on how that data should share with our communities. We have been very intentional in developing a relationship between community and Minnesota Department of Health, and just to overcome the traditional issues of discrimination and the multiple structural barriers within the system, and trying to be transformed by that partnership between system and community. Is a long way to go. Still working. We have had interesting moments of tension, good tension, healthy tension. We have grown a lot. And I want to end on that note. I see the beauty of this combination of knowledge and wisdom. We all have something very valuable to give to build the movement and to change the situation of disparities everywhere. So I'm very grateful for the work you have been doing and for setting the stage and allow me to talk about more of the community side of things. So thank you so much.